Hey, good morning. Let's talk about dry mouth. That seems to be I think, a regular occurrence for everybody who has had head and neck cancer, throat cancer treatments. That seems to be a recurring theme. Everybody seems to talk about dry mouth. And well, let's talk about that. Let's talk about what causes it and maybe some of the things we can do to alleviate that problem. So here we go. Let's talk about. So radiation therapy really affects the salivary glands, and that's why our mouth is so dry during and after treatment. Now it's been 15 months since my treatment started. I'm sorry, since my treatment ended in September of 2021, and I still have dry mouth. It still feels like the desert in there when I sleep at night. I wake up with a dry mouth. It feels like there's a giant rock in my mouth where my tongue's dried out. So yeah, just why is that? Well, the reason for that is your salivary glands are easily damaged by the radiation therapy that you get for your head and neck cancers. The severity of the damage is, of course, it's based on the amount of radiation and the proximity of the salivary glands to the target area. Now, they've gotten really good at targeting specifically to the tumors, basically, with the radiation. However, excuse me, there's still some bleed over. There's still some things that go on, and the radiation has to travel through. So let's talk about that. The salivary glands, there's three major salivary glands. The parotid glands, which are back here. The submandibular glands, I'm looking at my notes on this, submandibular glands, and the sublingual glands, right? And those are going to be right here. So if we look at this diagram right here, that shows you where these different glands are. Parotid, submandibular, and sublingual, right? Okay, so looking at that, that kind of gives you an idea. And since my particular throat cancer was on my left tonsil, that is just behind the left parotid gland and the left tonsillar lymph node. Man, dry throat, that dry mouth's killing me. While we were treating the tumors, my left parotid gland was subjected to a lot of radiation, as was my my submandibular gland. One second. A little warm tea helps. They were subjected to a lot of radiation. And as that radiation has to go through there to get to the targeted area. So once it got through there, these are now irradiated, right? And as expected, the treatment affected my saliva by reducing it and then producing a more thick mucus discharge. If you remember on some of my previous videos, I talk about that, how I had mucositis, back of the throat, very thick, heavy mucus, right? That's because the salivary glands were affected dramatically by the radiation. So after treatment, my saliva began to increase. I thought it was going to go back to normal, but I was wrong. While it increased, we are still 15 months later, and it's still not back to normal. How to deal with the dry mouth. One, talk to your doctor about it. There's some sprays, there's some medications they can give you to help you deal with the effect of the dry mouth. From what I understand, nothing can cure the dry mouth, but they can help you live a little bit easier with it. There was a gentleman, or there was somebody who commented on one of my previous videos about some kind of medication they were taking, a type of gel. And for the life of me, I cannot find that video. I'm sorry. For the life of me, I cannot find that comment. So if you're still watching these videos, if you don't mind, comment again and let us all know what that gel was you're using, or spray, and fill us all in. Maybe that'll help us out. We can get some names of some stuff. But again, talk to your doctor. Number two, carry a water bottle around with me. That's what I normally do. So if you see me out and about, I'm going to have a water bottle with me, and it helps me when I'm eating, talking, or just wandering about. When I'm eating, small bites, sip of water, helps wash everything down. Things don't get stuck. Talking when I'm teaching or when I'm talking to people, little sips of water, keep my mouth from getting dry. Number two, I keep a water bottle next to, number three, I keep a water bottle next to the bed, so when I wake up at night and I've got that super dry mouth and that rock we call a tongue stuck in there, a little bit of water in there, moisturize my mouth, feels a lot better, go back to sleep. And then, of course, we have to kind of accept it is what it is. We've recovered probably at 15 months. I'm going to say I've recovered as far as I'm going to recover. That's all I'm going to get out of it. There's no cure for dry mouth. There's no fixing the salivary glands as far as I know. And so it is what it is. So I will take the dry mouth over throat cancer any day of the week. And I can just deal with that, keep sipping water, maybe check out some of these gels or sprays or something, talk to my doctor about it. If you want to know more about how I dealt with post-cancer treatment issues that just might help you out, check out this video next. Thanks.